Dr. Agnes Binagwaho, I am so honored to have you here today and to have you at the African Women's Leadership Conference as one of our featured speakers. Ophelia Dahl, class of 1994 from Wellesley and current trustee and co-founder and current chair of the board at Partners in Health. It is truly wonderful to have you here with us. I do know that both of you have a very close relationship, and we're going to talk a little bit about that and partnerships as we move on in the discussion. Now, Dr. Binagwaho, I know that you like to be called Dr. Agnes, so I'm going to take the liberty and I'm going to call you Dr. Agnes.
Perfect.
You know, you've had quite a remarkable career that is only at mid-course, and I've learned in terms of your history that your parents had taken you away from Rwanda. You had moved from Rwanda as a young person and then moved back after the genocide in 1996. Can you tell us a little bit about what compelled you to move back to Rwanda?
So, I have a principle. We always need to know where we come from. And before I was 3, my father took all the family in Belgium because he wanted to pursue medical education. And when we were there, the first killing starts, 59, 60, 63. There was this change in power and this racism emergence of one party based on exclusion of the other and systematic killing starting. So my father decided we will never go back in Rwanda. He didn't taught her the culture, the language, and we were raised, like little Belgium, and I was okay with that. I had no problem. Up to adolescence, when I just recognized I'm black, they're all white. So what is behind my story? I learned for the first time about Tutsi, Hutu, and I try to find out, what am I? Why am I here? Why don't I have a country? What pushed me to come in this land where I'm not born and that I not really belong to? Then the genocide happened. I was working in France. My own family were already out of Rwanda since the year 60s. Many were killed already, but the family, the father side of my kid, they lost a lot of it. And it makes us afraid because it was out of any we cannot understand. But the father of my kids want to go back to Rwanda because he said, I need to go back there, I need to be part of the reconstruction. And we say, never. We cannot go to people who are killing each other like that, etc. He said, I'm going. So I say, okay, I have 2 beautiful girls. I was a pediatrician. I have night duty. Impossible to raise correctly 2 beautiful girls like that without a father. And I say, okay, let's go. So we will come the day you find a house. It took him 1 year to find a house. And we came during the summer, between 2 years, the academic years for our kids. The life there was nothing. I think the salary altogether was $75 a month. We cannot even pay for the house. And I say, okay, the failure will not come from me. But also before going, I went 1 month alone because I know my character. I want to own my failure because I didn't believe it will work. And I didn't want to be there and tell the father of my kids, you see where we are, it's because of you, etc. I want to see, you see where we are, we make a wrong choice together, where we go from there. So I had to sit and think, okay, I want to go, I have the chance, my children have access to school, we are healthy, we have a house. and I'm going to run away because it's hard, but it's more hard for the patient, the family of the kids who die and the kid who is sick than for me. If I move back in my security zone, who is going to fight for them? That's how I stayed.
I want to talk a little bit about the partnership that the two of you have had. And Dr. Agnes, to begin with, you clearly developed in this very difficult time, you clearly developed a vision for what health and the health system could be. I mean, you were seeing children dying. Can you talk a little bit about the development of that vision, what you saw, what you began to imagine?
So what I saw that I was not prepared to, because I grew up, I told you, like a Belgian little girl, and in that environment, is just to see people dying because they were poor or because of a lack of knowledge. Not because I didn't know what they had and I didn't know what to give, but I can give nothing because I didn't have that. Pure injustice. Say they are dying just because at 8-hour plane there is something that can save and we don't have it. When I decided to stay, I say I'm going to fight, and I'm going to fight not for those who can afford, who have the chance like I had to have friends overseas. If I was sick, I will say, hey friends, I need a ticket and I need to come back. They will have sent that to me. But for those who have even no knowledge that they can be saved elsewhere. So that was my bottom line. I stay to fight, and I stay to fight for those who have no power, no voice, and who are the victim of bad circumstances, meaning poverty, ignorance, and voiceless. We need to build things from scratch. And that's how really, when a couple of time later, I met partner in health where they were used to create system elsewhere. We had the same vision. We have the same desire to fight for the most destitute. We had the notion that education is for all, health is for all, and you should not die because you are where you are born.
And Ophelia, you as a co-founder, I mean, just talk a little bit about the founding, the principles in which you co-founded Partners in Health.
Well, interestingly, I think that the co-founding of Partners in Health was in some ways very similar, in the sense that when you arrive in a place, obviously under very different circumstances, but when you arrive in a place like Haiti, and you see that there is no system, that certainly no health system in the rural areas where we were, it's so easy to feel overwhelmed by what it is that you see, and you think, well, I can skedaddle back to London, which in some ways would be easier. But it also feels as though, how can you really do that if you've seen the way the world really is? If something's been revealed to you, and if you're lucky enough to feel as though you're connected enough to be able to make change. And I think that combination was important. And also I was lucky to meet and become very close to Paul Farmer, right at an age when I was the same age actually as some of those young women on the stage yesterday, who were talking about what they hoped for the future, and I think that making sure that you have a partner in this work in some way, I think is a very important thing. So we quickly got together with others, but we saw what was lacking in front of us. We didn't have the answers, and I think this is an important piece. We just knew that whatever it was that we could do would be better than what there was at that point. So it was very iterative in terms of us learning as we went along.
How has the partnership worked? How has it developed? And what are some of the lessons we can learn from the way that Partners in Health and you, Dr. Agnes, and the Rwandan government have worked together?
In Rwanda, I think Partners in Health has found partners all along the country and in the system and in the government. We are blessed in Rwanda to also be led by leaders that focus on the most destitute. So, and who give you the freedom to just implement the vision that we all have together. You have some indicator to reach that are ambitious, but you have the freedom to reach there if you are compliant with the law and the notion of human respect and development. I met Paul in my first trip in New York, where I was there almost by accident because I was free that weekend, and then it's a black woman from Africa who have some knowledge in HIV to be part of the team who will discuss the MDGs for HIV, and my name came up, and my question was, are you free this weekend? Yes. Can you be in New York? I say, oh yeah, oh yeah. I've never been in New York. I will go to New York, and that it was very serious matter. And Paul was in the room, and really there was a bunch of people who were talking without knowing what they were talking about. They were talking about my day-to-day life, where I was seeing people dying without medicine, people who will take the medicine correctly, people who just want to have a chance to give a chance to survive. And the way they were proposing to do things were totally, I told them it will never work if I apply what you say. And Paul was the most decent guy, most of the time silent. And when he was saying something, it was really talking to the reality we experience every day. So we sat together and we start to dialogue, and after that I invite all the team to come for the next meeting in Rwanda. They came. And Paul asked, can I work here? Oh my goodness. It's like asking Jesus Christ, do you want to come? I come to visit you on Christmas. And you say, oh, let me think about that. I'm going to see if I have it. It's on my table. No. I say, come, I bring you to the minister. And I bring Paul to the minister in charge of HIV and other disease. And the deal was so. And everything starts by there. But it starts so easily because same philosophy of pro-poor, same philosophy on human health is a human right, same philosophy of the poor deserve quality, deserve respect, same philosophy of I don't do for you what you can do for yourself, I accompany you to do what is good according to your desire. It was the only NGO that accept to fully support the public sector to grow. And this was speaking volume at the time when coordination of partners, there was a lot of partners who want to do good things, but with a little of arrogance and, you know, I know better than you, let me do. And it's not. They just came and said, where do you want us to work? What do you want us to do? And we just accompany you to do that. We managed to show the world that population health can really be changed by applying those principles of simple human rights. Use the science and human rights and you have the magic composition. You can make a portion of a country really change and giving health to the people, give economic, you empower them to be an economic actor of their own life. You bring back joy, hope, everything. So by acting in the health sector, we have really transformed.
I would add to that from our end of things. I think that going back to a word that you talked about earlier, it was so reasonable for us. It was I want to use the word easy, but nothing is ever easy if you do it really well. But I would say, relatively speaking, the Rwandan government and the leadership in Rwanda had a vision. So we were able to join with that vision and say, what can we bring to this partnership? we can bring some, some research experience. We can connect to other institutions. We can look at how we might be helpful to partner with you in supply chain. Send us where you need us the most. So they sent us to the most rural areas, which is where we're most comfortable. And in that sense, it felt good. And I would also add that at other times where we may even have disagreed with some of the approaches, but we didn't say we think our approach is better.
Right.
What we agreed to do was to say it's your country, it's your vision, and so we're along to help with it. And I'm thinking particularly there was a moment. So we had concentrated in these 3 specific districts. We were putting quite a bit of support, financial support, in order to build up some of the clinics, for example. And at some point, Dr. Agnes, who was the Minister of Health at the time, said, we want to scale up, and that means we're going to have to pull back some of the expenses that we're using. That you're, of course, things are going very well because you're pumping quite a lot of support and resources in. We need to scale up, and we're going to pull back some of the services. And we said, oh no, then the patients won't do so well. And she said, we got to do it because we want this to be countrywide. We don't want this to be sustainable.
Yeah.
So we
so
said,
if you, and also equity. When you are an external supporter, you can focus on a place. When you are a Minister of Health, you have to focus on the country.
Right.
And the only thing you never want, I never want, is 5-star portion of the country and other that remain miserable.
For sure.
It's better to grow slowly all together. You have the population with you. Then population frustrated because they are not there.
And then they start to move, as has happened in some places we've worked. You get large swath of the population that move from miles and miles away because there's healthcare that's good in that place and jobs. So it was very good advice, even though we protested.
Absolutely. And in the end, you destroy your country. You don't build the country.
As you lead, for both of you, as you've led through difficult times, you've felt challenges, you're building, say a little bit about the resilience you've built and how you've managed to keep focused and moving forward.
Resilience is very easy when it's not about you. It has changed my approach to life professionally. Meaning, if I had the wrong reaction, people are going to die. So I better reflect on how I'm going to handle this to save the maximum people. So you have a responsibility that oblige you to think twice before having a reaction. And when you cannot get immediately what you have, or when you really find obstacle, you find obstacle. At that time you say, how am I going to contain? So it's not about you. It's about doing the best to save the maximum of people. It's also about never compromise your soul, your vision. It's about being consistent.
Ophelia, what do you...
Well, I think that resilience is something that I feel as though I never had. I never thought about it as it was going along. I had now with a little bit of hindsight, you start to think about some of the more difficult times. I think that having parents, which I'm only really realizing most recently just how resilient they were. So there's something about being socialized for resilience. And I think that part of that is being able to feel as though you can affect some change. So I think that if I was during all of the hardest times of Partners in Health, or the hardest times in my life, I think the most difficult thing is feeling powerless. And I've never felt powerless. I've only ever felt like I might make a bad decision. And unlike you, my bad decisions, I feel as though I had a network of colleagues and friends around me to be able to support one another through the hardest times. And if you have a team of people that you're doing things with, and you can still be the leader, you could still be the CEO or the head of something, but you can still feel as though you have some trusted people around to help you. But resilience also is, I think, for the long term. I think that there's some long game to this work that we all do. It's not, a lot of the time there should be a great deal of impatience around things like inequality. There should be an enormous amount of impatience. And yet there are certain things you do when you're involved with putting a system in place. If you want that system to last, it's slow building, as it was 150 years ago when we built some of our systems.
Quick solution is the enemy of sustainability.
Yeah,
but the most important is to explain what you do. System, it's absolutely needed. Whatever you do, start with the legal framework. Why? Because if somebody wants to change, have to go to parliament. So you protect what you build for the vulnerable by a strong wall of law.
A very important partnership that you've embarked on now is the development of the University of Global Health Equity. And just the name is powerful. Tell us about the vision and then the partnership.
So the vision is, if we want the world to change for good, we need to arm the people who are working in that world with the knowledge how to do that. And the best place to arm people, young people, less young people, with a knowledge is universities. So our objective is to educate with time thousands and thousands of young people how to deliver quality service, finding the people where they live, and the majority of our brothers and sisters live in a rural area. That's why the university is based in a rural area, to really make the people that we educate really is to live in a rural area and to give service there and to be happy. And we believe that it is the best next step for an organization like Partner has. It's already in 10 countries, cannot be in all countries, in all places of the world. And the people we educate with this philosophy will go there, educate others, and by a snowball system, we will change the world.
Very powerful. Ophelia, what is the lesson for the United States from the work you're doing here?
Wow. Well, I firmly believe that although I think we live in a place where most people consider this health system that we have in this country to be pretty extraordinary, but I think I'm talking to two physicians now, so certainly it's clear that there are enormous gaps in the system that we have, and I think there's a great deal to be learned from work in places like Rwanda. What they have in Rwanda, and I think what we should strive to have here, is a complete health system. The components of that health system include something that's based in the community. So while I think we have amazing research capabilities here, we have extraordinary technology, I think we are missing a large component of care that could be in people's homes, in people's communities, and not forcing people to come to tertiary hospitals to seek care. That would be one important lesson I think we could take from that.
Well, and I think some of the young people that I know, that we both know, that have trained in the areas, I mean, some of them in Rwanda, some of them in other areas where Partners in Health has been involved, they do come back with the energy, with the passion, with the vision, and I think it will make us a better place, hopefully. Last words of wisdom to young women, the young women of Wellesley, the young women who are here for the African Women's Leadership Conference, and young women around the world.
So first of all, they're African young women, so they need to be proud of their history, not to be focused on this box of misery that the world described them now. The continent is the continent of the pyramid, the continent of Timbuktu, the continent of Mama Lucy. Social justice, have that every morning when you wake up, every night when you start to sleep. And the most vulnerable should be your target and your best friend. And if they do that, the world will be a fantastic world.
It's wonderful.
I would only add to that a couple of things. First of all, I think that if young women can do what it is that they love to do. It will often be what they're good at or that they become good at. I think that's very important. We talk about it often, but I think that making sure that you can connect to something that you love to do. I would say you might not know yet what it is that you're good at or that you love to do, and you don't have to have a plan right now. I would say if you can, let some of that unfold as your life unfolds, and don't feel like you have to have all of the answers now while you're still in your early 20s.
Yes. And also, you are not good at one thing only. I know I was a good pediatrician. I know I was a good Minister of Health. I know I'm a good Vice Chancellor. I don't know to what I'm going to experience tomorrow. But my task is bring quality care to the most vulnerable at everything I do. So they should find their motto and say that I'm good at many things. Don't listen to those who tell you the contrary. Don't listen to them.
I think those are very powerful words for this generation coming up. I could talk to you both all day. It is truly a joy, and just thank you for the work, for your leadership, for the work that you do in service to the most in need in our world, and we are so proud to be part of your sphere. Thank you.
Thank
And
you.
please come back to Wellesley.
Ah oui.
I will.